It's time for Talk of Tallahassee, a public affairs program highlighting key issues of concern for Tallahassee and surrounding counties.
Good morning and welcome to another edition of Talk of Tallahassee. I'm your host, Tammy Webb, and this morning in the studio, I am so happy to welcome Dr. Ron Whitfield with Whitfield Chiropractic Clinic. Good morning, Doctor.
Good morning, Tammy.
Thank you so much for coming in. I am so excited to talk about chiropractic care. That's how I should say it, right?
That's correct.
I want to give it a Y on the end for some strange reason. And as our audience is joining us this morning, I don't know, I've been to a chiropractor a couple of times in my life after an automobile accident because it was recommended. But before that, I had never really known or wasn't involved with chiropractic care. For those who don't know, can you tell us a little bit about what chiropractic care is?
Chiropractic is the manipulation of the spinal vertebra in order to remove nerve interference. Benefits of chiropractic care include increasing the flexibility of the spine, restoring the spinal ranges of motion, improving spinal alignment, and increased spinal strength, as well as better posture. Athletes value chiropractic a great deal because it improves their performance. Better spinal alignment and posture means better balance and strength. Restoring the proper spinal curvatures increases the strength of the spine and resistance to injury. This is why so many professional athletes have chiropractors, and some even have their own personal chiropractors that follow them.
And as I'm reading further, it also says it can improve your overall health, improve your lung capacity. And when I think of lungs, I think of all the campaigns going on right now about smoking and how it affects the body. And as a former smoker, can that help with my lung capacity, developing that back up after you put those cigarettes down?
Well, certainly. Improved posture is the key there. Restoring the normal spinal curves improves your ability to take in oxygen, expand your rib cage, and take in more air.
Okay.
So it does improve in it. As chiropractic is a holistic treatment. By restoring normal spinal alignment and reducing the interference that improper spinal alignment has on the nervous system, you increase the overall or total spinal health and also your whole body health, because the spine is the switchboard of the nervous system. All of the nerves from the brain exit the spinal column and go to every gland, organ, muscle in the body. And
so what you're saying is it affects every single body part.
Absolutely. Just as a proper nutrition goes to every place in your body, so does your nervous system affect every cell in your body. So a pinch from a nerve can cause a disturbance at a distant location from the spine.
Well, Dr. Whitfield, as you're talking, I'm watching, and you have perfect posture, so I'm like trying to hold my shoulders back myself. Is that one of the first things that you kind of look at people and say, okay, maybe you can improve just that one little thing, is by, sitting up straight in your chair or standing up properly?
Proper posture is really a key, and chiropractic adjustments aid in the ability to have proper posture by increasing spinal mobility and increasing your spinal strength and the flexibility of the muscles. You're able to stand erect more easily.
Oh, okay. Well, for instance, and I wish I had a camera in here right now because I'm curious. As you look at somebody's body, can you tell if their spine is aligned the way it should be, or is that something that has to be hands-on?
Most people don't notice the subtleties of misalignments, even in themselves.
Does it come with age, or?
It does. It does progress with age and lifestyle habits. The way we spend most of our time every day affects
sitting
our
in this
posture.
chair. Mm-hmm.
Absolutely, and most people spend a lot of time sitting these days, which puts a great deal of pressure on the spinal discs, and it is one of the most strenuous positions for the body, and it also makes it difficult to breathe normally.
Okay.
When you're sitting at a computer, normally your head will begin to flex forward.
Gotcha.
You'll lose.
And then you get that tension in your neck.
You'll get more tension in the neck. So our lifestyle these days has a great effect on our whole health.
Well, as we're discussing this, I know that the listeners are saying, but I have to. I have to sit at that chair every day. Can you give them a little bit of something that maybe they can do if they have to be in that chair? Some advice on how to maybe keep that spine a little better and things that they might be able to do on a day-to-day basis to help that out?
Absolutely, Tammy. That's a very good point, and it's one that most people overlook. We sit sometimes for hours without moving.
I do.
Yes, and that's not a good thing. We've lost the perspective that we're living a very unnatural lifestyle by doing so much sitting. And so one thing people can do is approximately every hour get up and move around.
Walk around your office building?
Just walk around the office, stretch, breathe, get yourself back in a proper alignment, and sit back down. It takes 2-3 minutes.
Now, you said something, and as you're saying it, I'm wanting to stand up. Is there a proper way, as you're standing at your desk, that you should stretch in order to keep your spine in the way it should be?
Yes, because so many people nowadays sit and look at a monitor, the first thing you need to do is set up your workstation so that you can have proper posture while you're working. Get the monitor up high enough where you can keep your head erect.
And I see you're looking around the studio. So is this too high, or is this about where it should be?
That's about eye level, which is very good.
Well, for me, I'm 5'2.5", so it's a little short, but for you, it'd probably be perfect.
That's about right. But a lot of people's monitors are sitting down on their desk, and you can't hold your head erect if you're looking down. So
simple little trick. Bring it up. Okay. Anything else that you can think of?
The support for your arms, your elbows should be at about a 90-degree angle on the desk, so that you're not slumped forward.
Oh, I see myself doing that.
Yeah. So there's a lot of little things that are quite logical if you think about it, where you can sit erect, have your work table at the proper height so that your elbows are at about a 90-degree angle. That way you can type, and your monitor should be at eye level or slightly above so that you can keep your head erect.
Right. Those are perfect tips. If you're just joining us this morning, we're talking with Dr. Ron Whitfield. He's a chiropractor. He owns Whitfield Chiropractic Clinic here in Tallahassee. And there's just so many different things involved with your spine. As we're sitting here, I have this little ache here, a little pain there. What are some of the symptoms that maybe you're having some problems with your spine? You said it comes on gradually. But if we catch those early enough, can we correct those? And can you help us a little bit with that aspect?
Yes. Other than the normal stretching routines and getting up and moving around constantly to keep your blood circulating and keep your breathing proper, you can do, for example, a little daily stretch routine that will help keep your spine flexible and strong.
And do you teach this to your clients when they come in to try to keep them in shape?
Oh, absolutely. And it's one of the hardest things to get people to do, because our lifestyle is so hectic nowadays that people don't take the time to do these things, but it really takes just a few minutes every day if you do it every day routinely.
Could you describe it to us on the radio?
Well, the spinal exercises are composed of two types. One is the stretching, and the other is the strengthening.
Okay.
The stretching is very similar to, I'm going to compare it to yogic exercises.
I was going to ask you if yoga plays a role in this. I'm glad you brought this up.
Actually, I got into chiropractic after going through
Okay, you opened the door, so now I'm going to ask the question. You opened the door. How did you think to yourself, I want to get into this?
Well, I got very involved in yoga.
Okay, and was this at younger age, or did you? Because I'm middle-aged woman here. Can I get into it now?
Oh, certainly. Anybody can do yoga.
So you were interested in yoga?
Yeah, I was about 23 years old, and I became very involved with it and other aspects of natural physical culture. And I did not know anything about chiropractic at the time. And I learned about it a couple of years later and found that it was very consistent with the philosophy of yoga, which has to do with using asanas, which are positions, in a very brief and stretching type activity to increase your spinal flexibility and increase the nerve flow to all areas of your body. There are also spiritual aspects of it, but this is strictly speaking of the physical aspect.
But your spiritual body and your physical body, once they're in sync, I guess is a good word, with each other, makes you feel better.
Oh, absolutely.
No matter what you spiritually believe. I mean, there's a spiritual side to almost every being.
Yeah, absolutely. The two are inseparable, actually. And your position as you work every day and as you go through life is also consistent with your spiritual attitude.
Okay.
If you have a good erect physical posture, then you're going to feel happier.
Okay. But sometimes when you're not so happy, maybe just doing the physical, the sitting up, the stretching can make you feel better.
Will push you in that direction. Absolutely.
I mean, you and I both have had those situations where, okay, oh, wow, I'm overwhelmed. And how do you handle that? I mean, as we're in our office and the boss is calling us down the hall, can you give us a little something that we could do to make this go a little smoother for us, maybe?
Well, always, I guess the most important and simplest thing you can do before any activity that might be stressing you out is to just pause for a brief second and take a few breaths very slowly. And that will put you in a better frame of mind, and it will also slow your mind down.
I'm thinking of an argument I had with my husband last night. And maybe if I had paused and taken your advice.
That's always good advice.
So there you go, whether you're married or single or whatever the situation is. Now, in your practice, there are just so many different things and so many different types of chiropractors. Am I right in this?
Oh, yes.
Because, I mean, I've been to one after an automobile accident, and I got to be honest, the only reason I went is because the insurance company said go. But then once I was there, I don't know, I was kind of a little apprehensive. Are your people that come in to see you a little apprehensive about?
Some are who have never been acquainted with chiropractic before, yes.
And can you describe, what happens when we would go, say we get in an automobile accident. There may be people out there right now going, I just got in a wreck last week and I'm not feeling well. What are some of the things that they can expect from a chiropractor or from the practice if that's what they need to go do?
An automobile accident involves a rapid spinal extension and flexion characterized by what is normally known as a whiplash injury. That's the most common form of injury from an automobile accident. And
I was going to ask you if that's really real, but it is real.
It is real. It's almost a cliche, whiplash, but it involves an impact which can be at a very low speed, even 5 miles per hour. But you have a 3,000 or 4,000 pound mass striking another mass like that, and you are an object within one of those masses, and that momentum is transferred through those heavy objects into a very light and flexible object, which is your spinal column. And even though seat belts do help stabilize your spine somewhat,
I had mine on, yeah.
They don't do anything at all for the neck, because your neck has to remain very mobile while you're driving. And so your neck is the most vulnerable part of your body to an automobile accident.
And that's where that term whiplash comes from, because you're whipping the neck.
That's right. There was a study done at Harvard probably 30 years ago or more, where they analyzed these physics of an automobile striking another automobile at 5 miles per hour, and found the acceleration of forces through the automobile into the neck is amplified greatly, even 200 times by the time it reaches the neck, in terms of the motion. That's very little motion occurs when 4,000 pounds taps 4,000 pounds, but the object within one of those can experience a great deal of kinetic energy.
I'm thinking of like maybe you've got a shaker bottle and a piece of ice in it. It's like just that quick motion.
Exactly.
Wow. So would you recommend that if someone has been in an automobile accident, they definitely go have themselves checked, even if they think, hey, I'm okay?
This same study cited that about 70% of automobile accident victims do experience some impairment from their impact.
70%.
Yes, and it may be only moderately or or not at all noticed at first. There are 3 phases to any type of injury. The first one is the acute phase, where you feel the impact. You get a little swelling, feel like you've been bruised, a little bit of soreness, and that begins to subside in a few days, and most people think, well, I'm fine. Well, there may have been some soft supportive tissue damage during that acute injury, and the body will go on and begin to repair that damage by putting in new tissue to repair the stretched or torn tissues.
Okay.
And while this is taking place, this is where chiropractic care is so important, because the next phase after the body puts in the new tissue is stabilizing the spine. And chiropractic can help restore the spine to the normal alignment and normal curves while that is taking place, so that you don't lose those curves and lose the normal alignment after the injury.
Once they're gone, are they gone?
Once they're gone, they require some type of therapy or rehabilitation to reestablish,
and
it
hopefully
becomes
not
more
surgery.
difficult.
I mean, you hear horror
Exactly.
stories about people who didn't do things and didn't take the steps, and then they go into back surgery. And I don't know, in your experience, I've always been afraid of any kind of surgical technology on the back. Every person I've ever known that's had it done has had problems for the rest of their lives.
It's pretty common. It is a last resort, and I don't want to minimize the help that can be attained from surgery, but it is a last resort, and it's rarely totally successful. It's a last-ditch effort, and much of these injuries and the results from accidents can be avoided by proper rehabilitation, therapy, etc.
And that's why our insurance companies now in this day and age, they didn't used to cover things. Now they realize that by using services from a chiropractor, you're saving years later that surgical bill.
Absolutely. An ounce of prevention. And
what's that old saying? An ounce of prevention, a pound of cure or something?
Absolutely.
Oh, I hear my mama's voice coming out of me now. Well, we're talking this morning, if you're just joining us, I know we're a little over halfway through the program, with Dr. Ron Whitfield, who is a chiropractor, Whitfield Chiropractic Clinic. Now, how long have you been practicing?
I've been practicing for 38 years here in Tallahassee.
Oh, my goodness. So you've seen the technology come from just out of school to all these variances. But isn't it basically the same? I mean, you are adjusting people with your hands.
That's right. The
Your hands are your
philosophy is
tools.
still the same. The techniques are many techniques have evolved, and there are a number of them, different techniques available in this town. And there are a number of additional therapies that are helpful along with the adjustment to restore and stabilize the spine.
Now, how can I'm at home and maybe I twist the wrong way or something. Are there things that we can do on our own to kind of help us before we would have to seek professional help?
Sure. I don't suggest anyone run out to a doctor immediately after any twinge that they may feel, but usually the best initial activity or response to a little twinge that you may feel would be to put some ice on it.
Okay, so what is the ice for? Is that for a sprain? Because I get this confused.
That's
A
correct.
sprain is ice.
Yes, the acute phase is when the body says, "Oh, I've been injured," and it starts a swelling and heat, and you feel some pain. Well,
So don't
ice,
use heat, use ice.
Don't use heat, use ice then at the
Okay.
acute, and that usually works for about 3 days. And if it's not better in 3 days, then you probably have done a little more than just a tiny bruise. or
Now,
sprain.
should we take aspirin, Tylenol, or is that just left up to the individual? Is one of them
Those-
better than the other?
Those are chemical anti-inflammatories. And aspirin's the classic one. Tylenol is a little easier on the stomach, and a lot of people use that nowadays.
So instead of I'm trying to understand, aspirin or Tylenol, but you shouldn't, is there something you shouldn't take for like the swelling?
There are so many anti-inflammatories, non-steroidal anti-inflammatory drugs out there now. There's Advil, ibuprofen.
But I'm just
and so
saying,
on.
is there one that we shouldn't take if we have a sprain?
Not particularly.
Okay,
If
so just go with your body and what you're
yes,
used to. Okay.
The simpler and
I guess I'm going back to the old momism again. I've raised too many children. Feed a cold, starve a fever. So I'm wondering if there's something, if you have a back injury, you should always go to ice.
Oh, yes.
Immediately.
Yes. And that's the first thing to...
Or a sprained ankle from a bike, fell off the bike or something.
Exactly.
But if I'm understanding you, my child's riding that bike and they're out for summer right now. So, chances are there's going to be injuries. The first thing I need to do, should I wrap it up after the ice?
The first thing you should do is ice it, elevate it. You can put compression on it. That does help as long as you elevate it. And rest it.
Okay, so after 3 days, though, I should probably seek some help.
Yes. If it's not going away in 3 days, you may have pulled a muscle, or worse, you may have torn some supportive tissue in there.
I want to go back to the back, though. Let's go back to the spine. Because, this is such an interesting part of our body, and I don't think a lot of people understand it. You mentioned this earlier in the show, that the spine affects everything. So if I'm having tingling, for example, I've had this occasionally, in my hands, is that related to my spine?
Every nerve in the body exits from the spinal column. So pains in distant parts of the body can definitely be caused by spinal misalignments, pinches at the exit from the nervous system at the spinal column.
What is a pinched nerve? I've heard this term in my entire life.
Yeah, it's kind of a misnomer, but it's...
Good, let's clear it up.
It's what happens when a vertebra is misaligned slightly, which reduces the opening that it has from the spinal column, and that causes some compression on the nerve, and it affects its normal ability to... It's just like a water hose. If you put your foot on a water hose, you will decrease the amount of water flowing out at the end. The same is true of the spinal system.
Wow. Well, I want to talk a little bit about something brand new that you had talked to me about before we started the program that is now in this country, and body cryotherapy.
Whole body cryotherapy.
What is that?
It's new to most people in this country. In fact, it's fairly new in general. It was developed in 1978 in Japan by a doctor who was looking for a method of reducing the pain before he manipulated and treated his chronic inflammatory disease patients.
Because they're in so much pain already, he didn't want to cause more.
Exactly.
Gotcha.
He wanted to kind of give them a little relief before he began to work on them. And as we spoke about earlier, ice is very good at numbing and producing some anti-inflammatory effects. And so he began working with liquid nitrogen, vaporized, and he called this procedure whole body cryotherapy. And here's how it works.
Okay.
There is a small chamber where a patient is put in for a brief period of time, about 3 minutes. The temperature is lowered in that chamber to minus 270 degrees Fahrenheit.
Oh, my goodness.
That's pretty cold. But
you said only 3 minutes.
Only 3 minutes.
And you're standing in this?
You're standing in this chamber, and the vaporized liquid nitrogen circulates around you for 3 minutes. The nervous system receives a message that is sent to the brain that this is so cold that I need to preserve life mechanisms. And so there's a powerful constrictive force of all the peripheral blood vessels. The blood is shunted to the interior of the body where it's circulated. Endorphins are released. Endorphins are your body's natural pain relievers.
Right.
And there's also a strong anti-inflammatory effect from the contraction of the blood vessels. Now, this goes on for 3 minutes, and this enriched blood in the center of your body and going to all your organs is enriched. And when the procedure is over, you step out of the chamber, and then there is a powerful dilation of your circulatory system, and all that enriched blood rushes back out to your skin.
Wow.
So this cold does not penetrate down to your core, so there is no lowering of your core temperature.
Interesting.
The brain receives a message that this is too cold, I've got to preserve life mechanisms. And so there's a stimulation of all these enzymes from your brain, the hypothalamus, and these enzymes, as well as the endorphins, elevate your survival mechanisms.
Gotcha.
Your basal metabolism is increased. You burn approximately 500 calories after the procedure.
Wow.
That's always interesting.
You saw me grinning at that one.
Yeah. And there's basically a increase in your body's natural immune system as a result of
that's
this
good news
procedure.
too.
Yes, there's a whole bunch of good.
Now you have this in your office?
I do.
And now how long have you had this? Because I hadn't heard this.
I've had this for about 2.5 years, and as you might can understand, it's rather hard to explain this to people.
But I'm understanding it now, and our audiences on our radio stations are now going, wait a minute, didn't know this existed, or maybe they did know, and maybe they're one of your patients, but now this is available in your office, and should someone need this type treatment, it's available here in Tallahassee.
Yes, it is.
Wow. What kind of results have you seen from it? I'm curious. I mean, give me an example of a patient that, you have felt like, oh, wow, if it weren't for this, I don't know how they would be dealing with daily life.
We have a great deal of good experience in cryotherapy. A lot of, it's most popular amongst athletes.
Okay.
And
we've got our colleges here and our national championship team. So
exactly. In fact, that's where it's been most quickly received because of the competitive nature of athletics these days. They're all looking for anything that'll give them an edge.
And this is a natural edge.
And this is a natural edge. It replaces the old ice bath, which was a...
Oh, I remember those things.
They're just a very uncomfortable...
You see them in the movies, and the guys are... yeah.
Yeah, and they lower your body temperature and your core temperature. They don't make you feel very good, but they do reduce inflammation. Now, this can be achieved in 3 minutes with this cryotherapy, and so Olympic athletes have adopted it. The Atlanta Hawks, Atlanta Falcons, they use it.
Wow.
My daughter has a salon in Atlanta where she goes out and administers these to the football camp, which she's doing right now. And they love it because instead of 20 minutes in an ice bath, they're 3 minutes in here, and they're feeling great.
Well, in our final moments, Dr. Whitfield, I'd like to ask, if people have questions and they need some answers, can they feel free to contact your office and get an appointment or just talk to somebody about the benefits?
Absolutely. We don't charge for consultations. I'd be glad to answer any phone calls that people have with questions about their health.
And what's a good way to reach you? Do you have a website, first of all?
We have a website, whitfieldchiro.com.
Whitfieldchiro.com, okay. And from there, I'm sure they can get your phone number and your email address or any other information. And I'm sure there's a ton of information on the website.
There's a lot of information on the website and a lot of information on cryotherapy and chiropractic.
And in closing, is there anything that you would like to add and let the listeners know about this morning?
I think we've covered a lot of things. And one of the great benefits of any type of holistic treatment for back injuries, one of the main benefits of chiropractic and the non-invasive therapies are an elevation of your body's natural immune system and ability to fight disease without the addition of drugs or surgery.
Because who wants to take a pill if you don't have to?
Amen.
Well, thank you so much for being with us on the program today.
You're very welcome. Thank you for having me.
This has been Talk of Tallahassee, an Issues and Answers public service program, covering issues of concern to those living in the Tallahassee area. If you have a concern you'd like to have discussed on our program, you can email us at tallahasseeissues@cumulus.com. That's tallahasseeissues@cumulus.com. Talk of Tallahassee is presented by WBZE-FM Tallahassee.